Hello, everybody, and welcome back to another podcast. It has been a while since I did a recording like this because after the last wave got over, we got a little more busier, and I also had a lot of my outside consultations to handle. And after a while, a considerable while, I'm getting some space to spend some time to do a recording. So today's talk will be more of a discussion rather than any specific clinical topic. So it should be relevant to both you as patients and to my colleagues. So many people, they, especially patients who come to our practice, are unaware of the pricing of dentistry or why dentistry is expensive. So how does a patient like you basically come to terms with pricing at our clinic or in any clinic that you go to? So we as dentists tend to design our services based on our patients or our clients' needs. So in that case, we have to focus on three things. So we want the quality or how good it is, how fast or how quickly you'll get your service, and how expensive or pricey it is. So we offer three kinds of service. They are good. Services ideally should be good, cheap, and fast. But out of these, you can only pick two because good and cheap cannot be fast. Fast and good can never be cheap, and cheap and fast will not be good. So if we are trying to offer all this in one shot, that is, if you want good services at a fast speed and at a cheap rate, then there is no standardization of service, and quality checking and the quality of the service that we offer starts becoming sporadic and biased. Which is why in a dental clinic, especially when you're dealing with the human body, it's not like painting a house or doing gardening, where it's not affecting your life personally. But dentistry and what a dentist does with your mouth and with your teeth and the materials that he or she uses, the equipment that the dentist uses for your procedures is important. So coming for example, I also know that I'm a root canal specialist. So let's talk about root canal treatment. Now, a root canal treatment consists about 4 or 5 stages, for which at the end of the treatment, the patient for a root canal pays between 3,500 to 6,000 rupees based on the clinic or the place where he or she is going to. The same root canal done in a European country or in the America costs around 70 to 80,000 rupees in Indian money. So you also should understand that the materials that are used there, the equipment that is used there, the protocols that are followed, the procedure, everything is the same. We follow the same textbooks that an American dentist follows. The difference is the organization and of course the insurance backed practice in the West, and the expectations also vary. So in India, the customer or the client or the patient is inclined to look at the cost incurred, whereas abroad, since they're getting insurance, they are more focused on the quality that they are getting. But that is a little insensitive or a wrong way to look at things, because you're again dealing with your body. So when you even take a root canal treatment, you should understand that there are a lot of materials, a lot of instruments that are used for that simple treatment. Starting from the injection that we give you for the anesthesia, we have to have different cartridges. We have, for example, we have lignocaine, we have atropine. Based on the situation, what cartridge to use, what kind of needle to use, the pre-anesthetic topical gel that we provide, the aerotor or the handpiece that we use, the dental drill, which spins at around 1.5 lakh RPM, the different the different burrs that are used, the endodontic files, the irrigants, the intracanal medicaments, your apex locators, endodontic motors, x-rays, the x-ray sensor, the sealing material that is used, the permanent filling material that is used, the impression material used for your crowns, the irrigant activators that we use. So there are tons of choices, tons of materials that we need to use just for that one treatment. And when the patient starts looking for cost cutting, it is only it is expected that the dentist also is going to do the same. Because for example, if you want to buy a car, you have options starting from a Nano up to a Bentley. The same happens in dentistry. So as you expect to pay less, as you want to pay lesser, and you want to go for cheaper alternatives, remember that there will be in the background definitely cost cutting or compromises done in the materials. It is not your fault, it is not a dentist's fault. But when you go with the expectation of paying less, the dentist also will have to provide the cheaper rate as per your expectation. So my advice is, when you're choosing your dentist, or when you're going ahead for a treatment, never base it on the cost. Base it on the specialty of the dentist, the specialization of the practice of the clinic, and as soon as you walk into a clinic, you are able to kind of, with a little bit of common sense, figure out the standards that are followed there, how clean and how well maintained and how organized the place is. So with these simple choices, with these simple decisions, it's good to choose your treatment rather than only following what is good, fast and cheap, because you can never get these three in the same way. See, for even in a clinic which is a good clinic, not only these materials, you will also have a lot of other add-ons like air purifiers, you have autoclaves, ultrasonic cleaners, all sorts of equipment which are all running behind the scenes to make your treatment successful. So it is always good to choose your practice, once again, based on the quality of the service provided. It should be good, it should be fast, and it should not be cheap. Another thing that we should know is that no healthcare provider, no doctor, no dentist, no nurse intentionally wants to do any wrong or cause any difficulty to the patient. Everybody will only seek to do the best. Yes, things might go wrong, there are mishaps, there are things beyond our control. We are not gods. So a lot of things can go wrong here and there. There can be errors, there can be accidents that can happen, but nobody intentionally wants to hurt or harm or disturb the patient. So with that idea in mind, it is good to see always treatments in a positive light. Now some of us cannot afford everything. So now suppose whenever you're going for a treatment, also explain your budget to the dentist. For example, there's no point talking about high-end treatments like implants or aligners when your budget is only a quarter of that. So as soon as you come and you're planning for a treatment, be honest to your dentist or to your doctor and tell that this is how much I can afford. Give me the options that are possible within this budget. So when you do something like this, it makes communication more free. It gives the dentist also an idea of how to channel the treatment and to give the right flow of treatment such that it doesn't affect the patient, doesn't burden the patient in any way, and also the output is as cheap, as good and as fast as possible. We can try to balance them to a certain level, but we can never try to give everything to the full 100% mark. So that is one thing. So always explain to your dentist what are your inhibitions, what are your worries, what are your inner fears regarding a treatment. There are some patients who have come here and we have referred to the dental college because the treatment modality, what they wanted, what they looked for is not going to be affordable for them. So definitely in a place like a dental college where students are working on you, the whole cost gets reduced. So going to a private clinic and expecting a dental college kind of cost with a private clinic service is not a good balance. So always choose your dentist based on the quality. Quality always comes first. Now always, for any treatment that we can do, there are always options. It's not like only this is possible or only A or only B is possible. We will always make sure, if the patient is keen, to explain A, B, C, D options, from the biggest to the smallest, or from the most expensive to the least expensive, or to the longest duration to the shortest duration. options are always available for any treatment in dentistry. So spend time with your dentist, share all your concerns so that the dentist can tailor make the treatment plan with your expectation. The more time you spend talking to your dentist, the more improved and more considerable and more comprehensive your treatment will be. So I hope you get a little bit of idea now on how to choose your dentist, on how to select the clinic that you are going to. And I hope the days ahead we see more patients and more dentists focusing on purely on quality first, and then of course try to add on speed, try to add on cost cutting in a good measure, in a very reasonable and a safe measure. So to all my friends, to all my patients, and to the world out there, have a good day.